So because of that, we can sometimes lose sight of the fact that these diseases aren't just a random collection of facts or symptoms. They impact real people every day. What is up, everyone? Welcome back to the channel. For those of you who don't know me, my name is Jordan, and I'm a second-year medical student in the state of New Jersey. In today's video, I wanted to talk about the unique experience in medical school when you learn about a disease that you have personal experience with. Medical school is a journey in itself, but when you're faced with a disease that has impacted your own family or your friends, it takes on a whole new level of meaning. For anyone who has applied to medical school, you know that the question why medicine is central to the whole process. This is the main topic of the personal statement, which is one of the biggest parts of our application, and I guarantee that pretty much any student has gotten this question on their interview day. For many students, a personal or family experience with illness is our first glimpse into the medical field. Learning about the condition, talking to the doctors or the care team sort of plants a seed in the back of your mind, like, oh, this is cool, maybe I would like doing this. And this sends us down a path of further exploration that sometimes lands us in medical school. We have a lot of experiences and we learn so much along the way, but the thing that pushed us onto this path in the beginning was that initial inciting event where either ourselves or a loved one was sick. And then you get to medical school. You're so excited to learn about how the body works and all these different diseases. You're sitting there in lecture watching a video, and then you're like, wait, I know someone who has this. There have been several times in medical school where I've experienced this, like when learning about pretty common things like asthma or the flu, but this concept really hit me hard during our last block, which was our GI unit. Thankfully, I've been pretty healthy throughout my life, but for whatever reason, a lot of my family members have had GI issues. So almost every week of last block, I learned about a different disease that either a family member is currently struggling with or had in the past. It can sometimes be emotional learning about one of these diseases, especially if it has taken a heavy toll on yourself or your family. For me though, learning about things that I have personal experience with really just piqued my interest and made me more motivated to study them. There's a good chance you got a rudimentary understanding of your own or a family member's disease when you were going through it. I mean, that is part of a job of a doctor, is to educate their patients about what is going on. But with that being said, you probably didn't learn about it in the same detail that you do in medical school. Doing a deep dive into the pathophysiology of why certain diseases develop and how the changes manifest into different symptoms is the main focus of the preclinical part of medical school. So I found it very interesting to learn about these conditions in way more detail than I ever thought I would. I have a pretty extensive family history of inflammatory bowel disease, and that was one of the biggest topics in our last block. There are two types of inflammatory bowel disease. There's Crohn's disease and ulcerative colitis. They're two similar conditions because, they fall under the same umbrella term, but they do have some distinct differences, and I found it fun to learn the details about how to differentiate them based on a patient's history and their symptoms. As the name implies, both ulcerative colitis and Crohn's disease are both inflammatory conditions, but the types of inflammation are different, and that's what leads to a lot of the differences in the disease course and some of the complications that can happen. I also found it very interesting to learn about the different medications for these conditions, the first or second line therapy, what you use for a flare versus maintenance. I've heard all these different medication names thrown around over the years just because of my family, so it was nice to learn what these drugs are, how they work, and why they're used for these diseases. I think the other thing I noticed when learning about diseases that you have personal experience with, aside from just the general medical interest, is the human aspect. We're still in our preclinical phase, which means a vast majority of our time is just spent staring at a screen studying. We have some patient care here and there, but that's not the focus right now. So because of that, we can sometimes lose sight of the fact that these diseases aren't just a random collection of facts or symptoms. They impact real people every day. I know what my family members have been through dealing with these conditions and how it has impacted their life. There's a saying that, the doctor is an expert on the science or the medicine, but the patient is the expert on the disease. That's because they're the one who has to live with it and feel how it affects their body every day. Now, of course, there's going to be some times where you're treating a patient for a condition that you had yourself, but that's rare compared to everything else we'll be treating. So I think learning about the diseases that my loved ones have had has given me a better perspective on what it would be like to treat a patient with that condition. And honestly, I think it's just made me a little bit more empathetic about everything we've learned. Like I said before, it's a little hard to get into that mindset right now because our biggest clinical experience we have is interacting with fake patients. If you don't know, a lot of medical schools will have standardized patients who are paid actors who memorize a script. And that's how we do a lot of our clinical skills and clinical exams because they can't actually bring in someone with appendicitis. Now, they are very good actors, don't get me wrong, but we still know that they're not actually in pain, so it's hard to fake the empathy. And I know treating a real patient who's actually in pain will probably fix that, but I still think that learning about diseases that my own loved ones have had is going to give me a more comprehensive sense of empathy. A similar concept to the idea that a patient is the expert on their own disease is the idea that doctors learn just as much from their patients as the patient learns from them. I've heard several of the doctors that I've worked with since I got here say this, and I think it's true. One of the best parts of caring for patients is connecting with them as a human and beginning to understand what their life is like. In my years as a medical assistant and my first year of medical school, I've had some amazing connections with patients and I've loved hearing their story. Earlier I talked about how learning about diseases that my loved ones have had has reminded me to think about how these diseases affect real people. But I think you need to go beyond that. When you connect with a patient and hear their story, it's not just, oh yeah, this is a real person. It becomes, this is a mother or a son or a grandfather. That adds even more context to how this person is dealing with this condition and what the goals of care are. I recently saw a patient who came in for knee pain, and the only thing that they really wanted to do was make sure that they can play with their grandkids. So with that added bit of information, we knew that as long as he can just manage his pain, then he'll be fine. He doesn't need a knee replacement. He doesn't need to go run a marathon. So getting the deeper context for a patient not only helps you build a stronger relationship with them, but it also helps guide your treatment and just makes things easier for everyone. So in conclusion, learning about diseases that you have personal experience with can get emotional and tricky, but for me, it's given me a better understanding of why a patient's story is so important and why you need to look beyond the disease itself. Alright, well that is going to do it for today's video. If you enjoyed, please be sure to leave a like below and subscribe if you want to see videos like this in the future. Thanks, and I will see you in the next one.